Ever feel like going to the dentist is like taking a trip back in time, like those clunky X-ray machines?
Yeah, I know what you mean.
But get this, things are changing and fast. We are diving into AI and how it's going to totally transform how we think about dental imaging.
Definitely. And it's a lot more interesting than you might think, too, when you hear AI and dentistry in the same sentence.
Yeah,
This
exactly.
makes you think of, like, robot dentists or something.
Right, exactly. So before we go any further, can you just give me a quick rundown of the tech that's changing things?
So we're talking about cone beam computed tomography,
Yeah.
or a CBCT.
Okay.
It's like this. Think about those old x-rays, right?
Right.
They're just flat, kind of like shadows of your teeth.
Right.
CBCT is like a 3D movie of everything. Teeth, jaw, even like the nerves and stuff. It's incredible.
Okay, so how does that help, say, I need a root canal or something? What difference does it make?
Well, let's say you need an implant, right?
Oh,
With CBCT, your dentist can look at the bone density and figure out exactly where that implant needs to go. No more just eyeballing it.
wow. So it's like super precise then.
Absolutely, yeah.
So where does the AI come in? We're not building tiny robots to clean our teeth, are we?
Not yet, at least.
Okay.
But seriously, where AI shines is analyzing data, and boy, do these CBCT scans have a ton of it.
Right. Yeah, I bet. But how does a computer, even a really smart one, make sense of a mouthful of teeth?
That's where the AI magic really happens. Algorithms, that's the key.
Right.
We can train them to spot things in these scans that even the best dentist might miss.
Okay, so it's like having a second set of eyes, but like super powered eyes looking at your x-ray.
Yeah, exactly. It's all about giving dentists more information, a clearer picture of what's going on.
That makes sense. So it's not replacing dentists, it's making them even better.
Exactly.
Gotcha. So now we've got these incredible scans and AI ready to go. What's next? What can these algorithms actually do?
Oh, this is where it gets really interesting. Let's dive into the nitty-gritty of AI-powered diagnostics.
Okay, let's do it. Okay, so we've got our 3D movie of the mouth, and AI is ready for its close-up. What can these algorithms actually do with all that data?
Imagine giving a computer the ability to not just see your teeth, but to differentiate between enamel, dentin, even tiny nerves within the tooth.
Wow.
That's one thing AI excels at, segmentation.
It's like the AI is highlighting all the important players in the movie for the dentist, right? Making sure nothing gets overlooked.
Exactly. And this level of detail is crucial, especially when you're dealing with something as delicate as root canal therapy.
Okay.
The research paper we dug into mentions AI being used to accurately map out the root canal system, which helps dentists avoid complications and ensures the procedure is as precise as possible.
Wow, that's some next level dentistry. But
Yeah.
I guess it makes sense. The more information you have, the better the outcome. What else can AI do? Does it just highlight things or can it actually, think about what it's seeing?
Oh, it can definitely think, in a manner of speaking. Another key task AI tackles is detection. This is where it gets really interesting.
Okay.
We're talking about algorithms trained to spot incredibly minute details within the scan. Things like microfractures in teeth, early signs of gum disease, even those tricky to spot cysts you mentioned earlier.
Okay, now you're talking. That's what I'm really interested in. AI acting like a super sleuth, uncovering hidden clues that could make a big difference in someone's oral health. Is that kind of early detection really possible with this technology?
It absolutely is, and that's what makes this field so exciting. Early detection is crucial for so many dental problems. Imagine AI flagging a tiny crack in a tooth that's invisible to the naked eye. Your dentist can intervene before it becomes a major issue, potentially saving you from a root canal down the line.
Talk about preventative care. It's like having a dental crystal ball. What else can these algorithms detect?
The paper specifically highlights AI's potential in detecting lesions, particularly those related to oral cancer. Early detection of oral cancer dramatically increases the chances of successful treatment, so this could be a game changer for patients.
Wow, that sends chills down my spine. To think that AI could have such a profound impact on something as serious as cancer detection is truly remarkable. Okay, so we've got segmentation, detection. What else is on AI's dental toolkit?
The third thing AI does is classification. Think of it as AI organizing all that information from the CBCT scan into neat little boxes.
So instead of the dentist sifting through tons of data, AI is playing the role of an efficient assistant, sorting everything and flagging the important stuff.
Exactly. For instance, AI can analyze a scan and determine if a patient has a specific type of bite problem, like an overbite or underbite.
Okay.
This can be incredibly helpful for orthodontists developing customized treatment plans.
So no more relying on those gooey molds and uncomfortable x-rays. Sign me up. It seems like AI is streamlining the entire process, making things faster, more efficient, and hopefully less stressful for patients like me.
Absolutely. It's all about using technology to improve the patient experience and deliver the best possible care.
Okay, but before we dive into the real world implications of all this, I gotta ask, how does AI actually learn to do these things? You mentioned algorithms, but it's not like they're born knowing how to spot a cavity, right?
That's a great question. It all comes down to something called machine learning.
So we've established that AI is basically getting a crash course in dentistry, but how does this machine learning thing actually work?
Think of it like, training a puppy.
Okay,
You don't just expect it to, understand commands right away.
right,
You show it examples, right? You reward it when it does good.
right,
And over time, it learns.
okay.
Machine learning is kind of similar. We feed these AI algorithms tons and tons of CBCT scans.
Okay.
Some are healthy, some have specific conditions.
And it learns the difference.
Exactly. The more data, the better it gets at recognizing those subtle signs.
Mm.
And here's the amazing part. They never stop learning, these AI systems.
Mm.
It's a continuous improvement process.
It's like having a whole team of dental detectives working on your case.
Yeah, like a superpowered team.
But okay, let's talk about what this means for me, the patient, right? Like, how does this actually change my experience in the dentist's chair?
Well, I think first and foremost, it's about peace of mind. Knowing that your dentist has the absolute best technology at their fingertips.
That's good, but can you give me something, I don't know, a little more concrete?
Sure. How about radiation exposure? We all know X-rays use radiation, right?
Right,
And obviously we want to keep that to a minimum.
of course.
Well, studies show that AI-powered CBCT can actually get the same quality image with a lower dose of radiation.
Oh, wow. So that's a win-win then.
Exactly.
Less radiation, same great images.
Precisely. And speak of wins, let's not forget about personalized treatment. Imagine your dentist using AI to, predict how your teeth might shift over time.
Whoa.
It's like custom-made braces or Invisalign.
That's incredible.
And this is just the start. As AI gets even smarter, we're going to see even more personalized dentistry.
That's amazing. We've covered so much today, the tech, the benefits, but before we wrap up, what else should our listeners keep in mind?
Well, like with any new technology, there are challenges. We have to make sure these AI systems are trained on diverse data sets.
Right, so it works for everyone.
Exactly. No bias, accuracy for all. And of course, we have to make sure it's accessible.
Right, so everyone can benefit.
Absolutely.
Well, on that note, I think it's time to wrap up this deep dive. It's been fascinating to explore the future of dentistry. And from the looks of it, the future is bright. Maybe even a little less scary for those of us who, hate going to the dentist. It's a good reminder that we're living in a pretty amazing time for technology. And healthcare is right at the center of it all.
It is.
So if you're as excited about the potential of AI as we are, keep listening. This is just the beginning. And hey, next time you're at the dentist, don't be afraid to ask about AI. You might be surprised at what you learn. Thanks for joining us on this deep dive.